another episode of Fun Facts at the Pharmacy. I'm your host, Dr. Christopher Greider. If this is the first time that you're watching the show, I am a pharmacist who actually works for Mark's Pharmacy located here in Northeast Ohio. The purpose of this show is to kind of give you guys some more information about different healthcare needs so you can make really good decisions for the most part, or if you have any questions about anything, we can hopefully help answer some of those for you. For today's topic, we're actually going to jump right into it because it is kind of a general hot topic that's going on. In a previous episode, we actually had talked a little bit about what COVID was. So right now with the pandemic, we're coming up on about a year out from when everything kind of went on lockdown. So a lot of the information that's being presented today could potentially change, but we do have a general idea of what's going on with it in regards to the vaccine realm. So we typically get a lot of questions at the pharmacy about vaccines, especially about COVID right now, what to do, what is it, how do we go about handling it, who qualifies. A lot of these questions we're actually going to cover in today's episode with you. So to help me out with this, I actually do have a pharmacy student here with me. His name is Dave, and he's going to kind of help guide us in regards to everything that we know about the current vaccines right now and what the future kind of looks like for that. Hey Dave, how are you doing today?
I'm doing well. Just to reintroduce myself because Chris did a fantastic job today. My name's David Whipke. I'm a fourth-year pharmacy student. I go Northeast Ohio Medical University, better known as NeoMed, and I've had the pleasure of being with Chris for a month.
Yeah.
So let's just dive right into it.
Yeah, so kind of starting off right now for the most part. It's been, like I said, it's almost been about a year since everything's kind of gone into lockdown. We've really focused on COVID for the most part. With that being the case, the state of the current affairs of, Ohio in general, or even just the general U.S., how are we doing so far with that?
Yeah, so to date we've had about 28 million total cases, which leaves us to date, about 69,000 new cases a day. The total deaths to date is about 490,000, which leaves us with about 2,600 new deaths per day. And the peak number of cases we've seen was about January 8th, which was understandable with like the holiday season and everything. That day we had about 350,000 cases. But since then, the trends have been going down. And it's good to see with the, like you said, with the vaccinations that's been implemented in this country.
Yeah. I feel like one of the biggest things that gets mentioned in the news right now is that we did sadly hit over 500,000 deaths that have occurred due to it. So we aren't quite out of the woods just yet. Like you said, the big thing is we are starting to at least level out a little bit more, not necessarily stopping the rise, but we're keeping it kind of in check for the most part, which is really good to hear. So with that being the case, you did mention with vaccines right now. So vaccines is pretty much the hot topic that we're looking at. With that being the case, there's a handful of different vaccines we've been hearing about. So I would say the big one is Pfizer. That was the first one that was approved by the FDA for emergency use authorization. With that being the case, can you talk to us a little bit about, Pfizer's current vaccine right now or what's going on with that?
Absolutely. So Pfizer has been made available to the public through the emergency use authorization through the FDA since December. And some of us know how it's been able to be distributed to the public. First, it was made available to the healthcare workers, and then now it's being made available to patients based on age and also disease states. So nonetheless, Pfizer is the first made available vaccine, and it is about a 2-shot series, just like the other available vaccines currently available, and it's about 3 weeks between the first and second dose. For some information that is pertainable to Pfizer is that it requires very cold temperatures in order to keep its stability. With that being said, people don't know how cold we're talking about. So to allow civilians to know how cold it has to be when it's distributed and sent to the pharmacies, it's about -80 degrees Celsius. So we're looking at very cold temperatures. And with that being said, it's very hard for most pharmacies to be able to store that specific vaccine. So those vaccines have actually been made available more readily through like hospital systems that have the ability to keep those freezing temperatures for the vaccine.
Okay. So yeah, with that being the case, we're kind of looking at, it's not common that you normally see these at most of your normal pharmacies at the moment. There are a few exceptions that I have found. I know, if I'm not mistaken, like Drug Mart in the area does carry Pfizer's vaccine right now, which is great. It's just the storage, like you said, the storage conditions being one of the hardest things. Now, one of the things that we've been hearing a lot about is in regards to the effectiveness of these vaccines for the most part. Can you tell us a little bit about like how Pfizer's vaccine
Yeah, absolutely.
works
So
with that?
Pfizer is actually the vaccine with the most effectiveness on the market. So it's worth noting that between Pfizer and Moderna, they both have about 100% effectiveness in terms of preventing hospitalization and preventing deaths. But with that being said, Pfizer still reigns supreme in terms of preventing the contraction of COVID. So Pfizer specifically is about 95% efficacious in terms of that. So it still reigns supreme.
Gotcha. And then just a little bit in regards to like, can you explain a little bit on like how the vaccine works? Because I know a lot of the times I get questions of, you know, is this like a flu vaccine? Is this a little bit different? Like, so can you dive into that a little bit
Yeah,
too?
absolutely. So it's worth noting that, again, I'm going to always make comparisons between Pfizer and Moderna for the most part because those are the two vaccines on the market. And it's worth noting that both are considered, and how they work, they go by route of an mRNA vaccine. So that's how they're like classified, let's say, per se. And what that means is that we introduce the messenger RNA of the vaccine. So when we introduce it to the body, the best way I tell patients to explain it is that we introduce a component that is responsible for coding for a protein structure of the virus. So we introduce something where our body are able to read it and construct the individual component of the virus. And that virus is usually just like a surface level protein or component. And then it teaches our bodies like, hey, if this foreign body's in our body, this is not good. And therefore it kind of introduces and instructs our body to attack the foreign substance. So with that being said, that's how these vaccines work. They introduce this foreign component that our body makes using the blueprints, and then it teaches our immune cells, specifically what we call them our T and B lymphocytes, and it teaches them how to attack the foreign body, and it also gives them memory, so whenever the foreign body is introduced to our body again, we'll know how to better fight it.
Perfect.
Which gives us the protection.
Yeah. So kind of looking at it right now, it's essentially introducing something that's there. So it leads into a little bit of what we want to talk about too, because we are going to cover a section that covers some frequently asked questions about, you know, the vaccine and things like that. But this kind of hones in on the one. So just kind of bringing this up now, some people have asked the question of, with mRNA, it's associated to DNA. So a lot of people typically know what DNA is at the end of the day. Is there any alteration or anything that would change with your DNA when you're introducing this?
Yeah, so that's a good question. So it's a common misconception that this vaccine has the ability to change our DNA, which it's absolutely not able to. So our DNA, so when we look at a cell, our DNA is housed in the nucleus part of the cell. So this vaccine, when we introduce this RNA component, it does not enter the nucleus, so it has no ability to interact with our DNA. So it is out there in like the cytosol portion of the cell. So like let's say a large body of water, it kind of floats in that area and never gets incorporated into our DNA. So it does not have the ability to.
Perfect. So I know you had mentioned that Moderna was the other one. So at this particular point, the two that are approved on the market as of today, at least, is the Moderna and the Pfizer one. So taking a look at it, because Moderna was also approved, let's talk a little bit about that one. So go ahead and talk a little bit about like with the Moderna vaccine compared to the Pfizer one.
Yeah,
there.
so the Moderna one was the second vaccine that hit the market. And it came up, I think it got approved for the emergency use authorization about a week or two after the Pfizer. And that one is let's just say from a logistics standpoint, a much easier vaccine to distribute to local pharmacies because, again, it did not require the very extreme cold conditions in order to house the vaccine. With that being said, most of the time it's shipped at about like 0 degrees Fahrenheit, so most like freezer systems, typical freezers of like refrigerators can pretty much house the vaccine and keep it stable from that standpoint.
Okay. And in regards to like the effectiveness, like you had mentioned there, how effective is this vaccine compared?
Yeah, so it does pretty well. It's not the 95% of the Pfizer. It's actually considered about 94% in terms of preventing people from contracting the COVID. But again, you still have the 100% protection in terms of hospitalization standpoint, and also from deaths as well too.
Perfect. And I think that's the biggest thing, is that a lot of people I know have asked me questions about the effectiveness, and it's a good point, which is the 94 or 95% that we have mentioned is a general like prevention of actually getting COVID itself. But like you had mentioned, that 100% is guaranteed to prevent the likelihood of ever getting super sick or having any serious issues. One of the things that's been coming up recently, and it's been a huge headline news, is that we're hearing about these kind of variant strains. With both of these vaccines, is there any information about how like effective they are, these variants? Because there's one in the UK, there's one we've been hearing that's been coming out of South Africa and South America right now. So do we have any information about that right now?
Yeah, so that's a good question. Something I looked into last night is that, like you said, the three variants that I'm aware of is the UK, the Brazilian, and South African. And from my understanding, Pfizer and Moderna both came out and stated that up to this point, they believe that their vaccines has efficacy to a certain threshold in order to provide protection against the current strains out in the world right now. But because they're unsure with further mutation and variants that are going to proceed moving forward, they've already took the liberty to look into boosters for both of their vaccines as well too. So yes, at this moment in time, it does provide protection for the variants out in the world. But moving forward, we are uncertain how many additional variants there will be, and therefore both companies are looking toward to new boosters for the available vaccines in the market.
Perfect. Yeah, and from what I understand as of right now, at this particular time of this recording, I know Moderna has submitted their booster already to the National Institute of Health that essentially is to help against this variant that's coming out of essentially Africa right now. That's the big one that they've been having some issues with. But yeah, they did confirm that the UK variant that's been more emerging right now has actually been covered by the vaccines, which is fantastic to hear. So that way we don't have to worry about that nearly as much as long as you get vaccinated for that. Yeah, so looking at it right now, I've gotten a lot of questions, especially at the pharmacy, about some other vaccines that were becoming available. So can you let us know about some of the other ones that might be like on the horizon or might be coming out here sometime soon?
Absolutely. For the most part, I know AstraZeneca is working on vaccine. There's a Novavax, and then there's a Janssen's, and then there's the notorious Johnson & Johnson that is coming out that's close to hitting the market.
And do we have any information at this particular time about any of those vaccines?
Yeah, so I think the Johnson & Johnson is the closest in terms of hitting the market and getting that emergency use authorization. I think this Friday, actually, the FDA is getting together to reevaluate its candidacy for the emergency use evaluation. And with that being said, if approved, the Johnson & Johnson could hit the shelves as early as March.
Fantastic. Now, the one thing that makes Johnson & Johnson a little bit different is in regards to like how many doses it is, and in regards to the effectiveness. So can you touch on that just a little bit there?
Yeah, absolutely. And which brings back a good point. I never actually touched upon the amount of doses that each vaccine gives us. So just in a comparison, it says, just because I know we use Moderna, and so we're very readily aware of how many doses. But it's worth noting that the Moderna gives us, on average, typically 10 doses to provide to the public. So one vial provides about 10 doses. With that being said, the Pfizer gives us about 6 doses. And then the Johnson & Johnson, it's already theorized, because once they produce in mass production of the Johnson & Johnson, it's going to be good for about 5 doses.
Okay. Yeah. In regards to like how many shots that are required on that one. So we had mentioned like the Pfizer was a 2-shot series.
Yep.
That was 21 days. Moderna is also the same 2-shot series, which is separated by 28 days. But with Johnson & Johnson, how is theirs different with that?
Yeah, so from a patient standpoint, there's usually a huge demand already for the Johnson & Johnson, because like you stated, the difference being is that this vaccine is only going to require 1 shot.
Okay. So with that being the case, I know there's been at least a little bit of information. We haven't gotten the full scope of everything just yet. How effective is the Johnson & Johnson one compared to the other two then? So if we're talking one shot versus two, is there a difference in its effectiveness?
And unfortunately there is, but again, some protection is better than no protection. And as of right now, it's showing on average, about a 67 to 68% effectiveness in protection.
Okay, so it's not providing as much protection, but like you stated, anything is better than zero at the end of the day. So we want to make sure everybody's at least got something going on for them. Perfect. So taking kind of a look at it right now, there were some kind of questions that are typically brought up. So one of the big ones that we also get, so not even just focusing on the DNA aspect, but just looking at it, is it possible to develop COVID from getting the vaccine?
So actually it is not possible. So we are not introducing a live virus to the body, and so those vaccines are the only ones that it's possible to get the virus from a vaccine. So again, I'm going to restate this and reiterate it. It is not possible to get the virus from the vaccine. So some patients like, oh, but I got my first shot of the series or second shot of the series and I still got COVID. It's because it takes a couple of weeks for the full effects of the vaccine to kick in. And so when patients get, let's say, the shot yesterday and then they got exposed to a person who's positive for COVID, it is at that time that they contracted the virus just because the full protection of the vaccine was not in place yet at that time. So no, you cannot get the virus from the vaccine.
Okay. And you bring up a really good point, which is a great question that I get. So how long after you get vaccinated does it take to reach those effective rates that we're talking about, those 94, 95%?
Yes. So since it's a two-shot series, it's important to note that it takes about 2 weeks for each shot to kind of kick in for its full effectiveness. So when a patient receives the first shot, they could be as much as 80% protected, but it takes about 2 weeks post getting the first shot to reach that 80% protection. After receiving the second shot, again, another 2 weeks elapses, and then it's at that point in time, patients are about 94, 95% protected.
Okay, so normally it takes about anywhere from 10 to 14 days afterwards to reach that effectiveness, which is good to know. The other thing that typically comes up is we have patients that always ask questions about, side effects. That's the number one thing when we're talking either medicines, vaccinations, anything associated to it. So in regards to these vaccines, is there anything unusual, I guess, in regards to side effects, or what should somebody expect to see when they get these vaccines?
Yeah, that's a good question. Unusual, there's always particular extreme cases, none that I've seen in the month that I've been administering these vaccines, but some typical side effects I could definitely run through. So your side effects are going to actually differ between the first and second shot for the most part in terms of common side effects that we see. So with the first shot of the series, most patients just get kind of more localized reaction, whichever arm we choose to inject. With that being said, we're just looking for possible swelling, inflammation, pain in the local area. In terms of the second shot of the series, that's where we're typically seeing more flu-like symptoms that arise. So we're looking more into the fevers, the headaches, the total body muscle ache, the chills, and potentially fatigue set in for most patients.
Yeah. And I know one of the things that always gets brought up is that sometimes the side effects can go for a little while afterwards. So most of the time we're looking at it, it normally occurs within about 24 to 48 hours, but there have been some cases of people having some issues maybe about a week out. With that being the case, I've also heard of some interesting cases. It's not to deter anyone away from the vaccine, but there have been some really, really rare cases of potential Bell's palsy developing, which has been kind of a concern. So if the one thing that I always stress to especially all the patients out there right now is that if you do get the vaccine done, you will get some questions if you end up in an ER for any particular reason. Do not panic if you have this question asked. It's because they're trying to double check to make sure that that may not be a potential cause for it. The one thing to kind of keep in mind is that Bell's palsy is essentially a lack of muscle function or control. And we're talking typically in the face, so there can be some drooping and stuff that can occur. This is reversible, so by all means, please don't think this is going to be a permanent effect. It's not meant to scare anybody away, because like I said, haven't had a single case, at least in our pharmacy, had occurred yet. but they have been looking into it a little bit more at this time just to double check and make sure. And if you do check any of the information given, it is mentioned as a potential effect there too. So kind of looking back at it right now, the other question that I typically get from a lot of people is, does this remove the need for, say the current measures that we have, the 6-foot distancing, the masks and things like that? So with being vaccinated, do you think that's a possibility, or how do you think that's going to go from here?
I think it's a possibility in the future, but at this time, I don't think it takes away the need from maintaining that 6 foot of distance, the masks, constant washing your hands, being consciously aware of your surroundings. I don't think at this time it does, because in order for the full effects of this vaccine to kick in terms of a perspective for the entire country, for your friends, families, and neighbors, we have to reach this threshold of 70 to possibly 80% for this herd immunity to kick in. And what herd immunity means, bare bones, is that enough of the population is vaccinated. So that for those who are unable to get vaccine due to health issues, due to inability, due to allergic reactions, all that kind of stuff, in order to protect a population to the level that we would like to see, we would have to vaccinate a good number of the country, and we're not at that point in time.
Okay. Yeah, I know they have ramped up at least vaccine production at this particular point, but like you said, I don't think we're near that point just yet. Nationally speaking, I know Dr. Fauci had talked about it during a recent interview, saying that like you said, those numbers are about what we're aiming for right now. It's just, it may not be coming up until maybe sometime this summer, hopefully, as long as the vaccine rollout continues, and we can get enough of it out there, if anything. So, with that being the case, you did mention one good thing that I think we need to double check on, which is in regards to allergies. Are there any exceptions about people who may not qualify for getting the vaccine, whether it be the Pfizer or Moderna's at this time?
So what's good about this vaccine, it does not contain any eggs, preservatives, or latex. So people who are allergic to those components are able to get the vaccine. In terms of people who can't get the vaccine, it's potentially, we worry about those who've probably had allergic reactions to other vaccines, or have in terms specifically, we term it anaphylactic reactions. So that's ones where we're kind of talk to your doctor, talk to your healthcare provider, certified nurse practitioner, whether or not you'll be eligible for the vaccine.
Yeah. And I know one of the weird ones that typically comes up, and it's just because of the components that are in there. I know at least with the Moderna vaccine, if you have a severe allergy to Miralax, as a prime example, that is one of the prime ingredients that's typically thrown in there, so we always have to be cautious. So if you do have an allergy to Miralax, you actually may not qualify for the vaccine at this time. That may change with one of the other vaccines, such as Johnson & Johnson's may be available at that time, depending on what they make the vaccine out of. We just don't have a completed list yet to say for sure what's going to happen with that one, but yeah, perfect. With that being the case right now, you did mention something about age groups. So who does qualify at this particular point for the vaccine?
Yeah, so I could only speak pretty much from an Ohio standpoint, because I know everywhere where they're rolling out a vaccine, it's like a statewide by statewide basis. So nonetheless, at this point in time, from my understanding, is that people at least 65 and older are eligible for the vaccine, as well as patients with specific disease states.
Okay. Yeah. It hopefully, from what I understand, I'm hoping at some point here we'll be able to roll it to the under the 65, but like you mentioned, there is an age restriction, and it's one of the hardest things, I think, is just because we do have to follow according to the Ohio Department of Health, who's providing everything. The last question that I'm going to have for you today, looking at it, is in regards to cost. That's the number one thing I also get a lot of questions about is, do I have to pay for this vaccine? So do we have any information about that?
Yeah, absolutely. And what's fortunate about us is that our federal government is taking on the cost for its citizens. With that being said, if a citizen has private insurance, public insurance, or uninsured, doesn't matter what, you're eligible for the vaccine. So.
Okay. And there's zero cost to it, correct?
Yes, that's correct.
Perfect. So yeah, well, thank you so much for all the information today, Dave. It's really helpful to kind of get some insight in regards to like vaccine and like what we're looking at potentially here for the future. And hopefully, like you had mentioned, hopefully we can reach this herd immunity to better everybody out, to make sure that everybody can stay safe and that we can kind of remove some of those measures. With that, we have come to the end of this episode today. One of the big things that I'm going to display for you guys here at the very end is a general list of locations that potentially can provide the vaccine. It's going to change according to the area and the county, but the one thing that I've had a lot of questions about is, do I need to specifically stick with the county? If you do decide to go with the health department of that county, then yes, it's based on where you currently live. So if your address is located in Summit County, you would go through the Summit County Health Department. Same with like Portage County and any of the other ones in the area. The one thing that I do say is that everybody does handle this a little different, so please be patient right now. I know it's been a nightmare for a lot of people to try and get vaccinated, and I know a lot of places are typically doing signups through a computer. So my one piece of advice for that would be at this time is if you have a friend, a family member, somebody close to you that does have access to a computer system, they can try to sign you up. You can reach out to certain locations to see if they may take any kind of in-person sign up or over the phone sign up. But at this particular time, most places that I've at least talked to, including a lot of your local pharmacies, we're mostly just doing it online. The reason being is we do have to space everyone out. And just as David mentioned, one of the biggest issues we run into is that those vials only have so many doses. You hear a lot of headline and news stories right now across all different states of like these wasted doses that are being thrown out. Our ultimate goal from a pharmacy standpoint is to not waste a single dose. We will literally call people that were signed up with us to try and get them in to make sure that we're getting these doses out to the patients. Our goal is not to waste a single drop if we can. So just kind of keep a close eye on it right now. A lot of your scheduling tools and things will update typically either daily or about once a week for sure. And it depends on how fast the rollout occurs right now. So as we get more vaccine rolling out and as different vaccines are coming available, you might start noticing that we'll have more availability of those coming out. But if you haven't been fortunate enough to get your vaccine completed and you want to, just keep with it right now. Like I said, it's a very hard time for all of us. We've all been extremely stressed out trying to kind of pick up the pieces and make sure that we can vaccinate everyone. A lot of places just don't get a ton of doses each week, so that's why we have to do it kind of in segments. And we want to make sure that people are spaced out because we don't want 100 or 200 people all coming to the pharmacy at once to kind of bombard us at the same time or stand around, because then it presents a huge health crisis of people being close together, and we want to keep people at 6 feet apart. With that being the case, if you have any questions, concerns, anything that you have want to know about in regards to this show right now, double check with a lot of your pharmacists, your doctors, your other healthcare providers, your nurses, nurse practitioners. We're a great resource to kind of help you guys out to try and figure out, is this the right thing for you? If you are hesitant about it, I mean, by all means, please ask questions. It's the best thing you can ever do to see if it's something for you. With that being said, thank you guys for tuning in, and we'll see you guys next time.